Welcome to the brand new episode of Youth Diary. A gynec is somebody who provides solutions to the entire womanhood. Today we have with us Noshin Ashraf, Infertility Specialist and Director, Kraft Hospital. Welcome ma'am to this new episode. So you're an infertility specialist.
Yes.
So when do you actually consult a couple to come for the infertility evaluation?
Okay. Generally, when a couple fails to conceive or become pregnant after 1 year of unprotected sexual intercourse, then they require an evaluation.
Okay, thank you doctor. Now let's move on to the queries. So this is the first query.
Hi, I'm Krishna. I have a doubt. One of my close friend has severe abdominal pain during periods, and she consulted a doctor and had a scan. Then they found a cyst in one of the ovary. So my question is that what is a cyst and what should we do now?
It's quite sad to hear that nowadays even young girls are having endometriosis. From the history she revealed, mostly her friend is having a chocolate cyst which is due to endometriosis. Endometriosis is a condition where uterine lining cells are present outside the uterus. So what happens is like when a girl is having menstruation, just like how the uterine cells bleeds, these cells which are present outside the uterus also bleeds. This leads to severe pain and then eventually leading to scarring, adhesion and cyst formation. The sad part of the disease is that it's a progressive disease and the disease gets suppressed only during pregnancy and after menopause.
So what can be done in this situation?
A scan has to be done to know the exact size of the cyst and to rule out the malignant nature of the cyst, though it is very rare. And then depending on the size of the cyst, the management protocol varies. Suppose if the cyst is very small and if she is unmarried, then she can be given a few courses of OCP which will suppress the size of the cyst and will take care of dysmenorrhea, that is severe menstrual pain that she is having. Suppose if the size of the cyst is huge or there is a doubtful malignant nature, then the cyst should be removed. But what I need to stress is that maximum amount of ovarian tissue should be preserved during surgery. Studies have shown that most of these girls and then women with endometriosis are found to be subfertile in later part of their reproductive life. So they should even plan for a pregnancy at least before the age of 30 years.
Okay. So doctor, you mentioned the term OCP. Yeah. So what is an OCP?
It is oral contraceptive pills.
Okay, pills. Okay. Thank you doctor. Now let's move on to the next query. This is the query.
Hi, I'm Bhima. I have a doubt that my aunt had a history of pregnancy loss during 4th and 5th month of pregnancy, and now she is 2 months pregnant. And what are the precautions that she should take during pregnancy?
First of all, we should try to find out the cause for her multiple abortions. Abortions happening in the 1st and 2nd month of pregnancy and those happening after 3rd month of pregnancy are very different. The common reasons for the abortions happening after 3rd month of pregnancy is mainly due to uterine anomalies, that is abnormalities in the uterus like septate uterus, uniconvate uterus, biconvate uterus and all. Another common reason is cervical incompetence. Then the other cases like immunological disorders or infections can all lead to abortions. She should be detailedly evaluated before attempting for a next pregnancy to prevent the same mishap. What is to be what we can do is that we can do a detailed first trimester screening test. Okay. It is a non-invasive test and involves 2 steps: a combined blood test, maternal blood test and an ultrasound evaluation to rule out major anomalies and a nuchal translucency test. Okay. This non-invasive test is called as first trimester screening test. This has got a positive predictive value of almost about 85%. Okay. That is 85 out of 100 babies affected with the chromosomal anomalies can be detected by this test. And again, if we are doubtful, if at all the finding has to, if at all the results turns out to be doubtful or we are still doubting it, then this can be confirmed by a NIFTY, which is a non-invasive fetal trisomy test. The advantage of the NIFTY is that this has got a accuracy similar to that of amniocentesis and chorionic villus amblis, and the advantage is that it is non-invasive. From the history she revealed, her aunt is most likely to have a cervical incompetence. Cervical incompetence is a condition where the sphincter around the cervix weakens and then it fails to hold the pregnancy, leading to early preterm labor. So the cervical incompetence can be easily diagnosed by doing a serial ultrasound monitoring of cervical length, and if any time we find the cervix to be short with this relevant history, we can do a high cervical insert clutch, and then that will save the pregnancy. Along with this, I would like to ask her to do an immunological testing, that is ANA, that is anti-nuclear antibody testing, and APLA test, anti-phospholipid antibody test. And if this test is found to be positive, she should be on heparin therapy and aspirin throughout the pregnancy to prevent the abortion.
So what is the test all about?
This is an immunological test to detect for the autoantibodies in the body. Okay, because if there is these antibodies present in the body, it can lead to abortion unless treated.
Okay, so treatment is necessary.
It is necessary if this test is positive. But what happens, like many places, they empirically give the patient this medicine. Okay, so that is not suggested. But one more thing I would like to insist is that absolute bed rest is not required for all these patients.
Okay.